Dr. Anas. I am an overseas qualified dentist. I want to come to the UK and work as a trainee dental nurse or as a dental nurse while I'm preparing for my ORE or LDS exams or while I'm studying. Is that possible? This is a question I get asked every day from my colleagues and peers overseas about the dental nursing. In this video, I'm going to talk about the dental nursing as a job, how we can get a job, what is the pros and cons, what are the benefits of doing the dental nursing while we prepare for the ORE exam. If you're interested, stay tuned and watch the video to the end. Welcome back to the channel. As I mentioned earlier, in this video we'll be talking about dental nursing. If you like the channel, you like the content and you enjoy what you're watching, please subscribe and support the channel. According to the statistics, there's only 36 or 37% of the people watching my videos are subscribers. So if I can trouble you to subscribe to the channel before we go ahead and watch the video, I really appreciate it. It means the world to us and to me to see that support, and I will carry on giving you whatever I can and the best I can with this free content, so you can always come back to it and watch it, and will be your tool to always see and direct you where to go. So working as a dental nurse seems to be too appealing to everyone. Very interesting job to do while we are in the UK and preparing for the ORE exam, so we stay in this atmosphere. This job can tick a lot of boxes for people, can cover some of their expenses, daily food, shopping, travel expenses and their accommodation. So this kind of job, it is available and it can be done. But what is the truth about it and how easy it is to find one? So what is dental nurse? Dental nurse or a dental assistant is a job in the dental practice where you support your dentist and you work with them alongside to look after the patients, do some suction, alginate mixing, preparing instruments, preparing extraction instruments, giving instructions. This job has a lot of duties and it is classed as a professional job by the GDC. So dental nurses are also regulated by the GDC, just like the dentists, the dental hygienists, therapists, technicians, and dental nurses. So as a dental nurse, you can be qualified dental nurse or you can work as a trainee dental nurse. I'll go through the differences between them to know what is this and what is that. So what are the benefits of being a dental nurse and work as a dental nurse for me as a qualified dentist overseas but not qualified in the UK? So first thing first, myself, when I was in the UK in my first early years, about 2016, I was still preparing for my ORE exams. While I was preparing for my ORE exams, I did a lot of different jobs. I worked in restaurants, I worked in barber shops, but like none of these jobs benefited me in a way that I can stay in contact with patients or can improve my skills. So I looked at something else, something that can keep me in touch and in contact with the dental atmosphere, with the dental updates, so I won't really forget what I'm doing while I'm preparing, so I still be there and it will be as a motivation for me. So I looked online and I found that I can do what we call a trainee dental nurse. Trainee dental nurse is you work in a dental practice without being qualified as a dental nurse, but you have to be enrolled in a course and you should have a witness or a supervisor in the practice as a maybe qualified nurse to monitor your work, and you work with a dentist. Trainee dental nurse will keep you in the dental atmosphere. You'll be in contact with the patients, you will see how dentists work, and you will improve your communication skills in addition to clinical skills. So most of our education and teaching comes from direct supervision of, let's say, our peers, our colleagues, our mentors and tutors at university. So when we start by shadowing, by watching, and then we start practicing. This role and dental nursing allow you to watch and shadow these people for free. Not only for free, but also you'll get paid for this. So you can work with specialists, you can work with someone in the NHS, you can work even with sedation patients. So you can do a lot and you can watch a lot while you are getting paid and staying in the dental atmosphere. In addition to this, in the UK, 90% of our daily dentistry, life and job is communication. So 90% of dentistry in the UK is communication. If you know how to talk to your patients, how to deliver your ideas, how to speak in layman words without using any jargons, how to be empathetic, sympathetic, show them that you are always always looking after them. This is what matters to patients more than your clinical skills. You can be the best dentist in the world and you can deliver the best nice treatments, aesthetic ones, but as a person you can't speak, you can't communicate in English, and that will be a big language barrier, and patients will sometimes perceive it as you are arrogant, you don't understand their needs, you're not showing any empathy to their pain, so they start to feel a bit agitated and they can sometimes put complaints because you cannot communicate properly. And to improve your communication skills is you have to shadow dentists working and listening to them how they speak and how to communicate to these patients. And my communication skills, still now I say it, and I always appreciate these people I worked with. It's from them. I learned a lot from them. I learned their communication skills. I learned their techniques. I even watched their surgical skills. I was fortunate enough to work with an oral surgeon and I worked with a periodontist. I've seen a lot of implants being placed. I've seen implants being restored. I've seen surgical extractions, big surgical procedures, wisdom teeth removals, perio surgeries and grafts. So all of these things, I learned it, and I learned it for free. Not only for free, but also paid for this. So this time was amazing and I always appreciate it and I will never regret it. In addition to this, you will learn how to use the dental softwares like R4, like Dentally, Kodak. You will know how to use the digital x-rays, how to take x-rays properly, how to deal with proper human beings, not only phantom heads. And also you will reflect on your learning. So as you are preparing for, let's say, your ORE part 1 or part 2, in part 2 there's OSCEs and dental treatment planning. In these things you work with actors. So you should do tasks and stations with actors. In your daily life, in dental practices, as a dental nurse, you will work with patients, with real patients. So you can reflect and look like, okay, I did this when I was doing my OSCE station, and it's really like this in real life. It happens. So you learn more about it. You learn about the logistics, the CQCs, the NHS. You learn how to do NHS submit treatment plans, how to apply to specialities. You will meet a lot of interesting people. You will grow your network in any place in the country. Your network is very important. So this job is a really great opportunity for anyone in the UK studying, being on a spouse visa, on a work visa, and they can do dental nursing. Do it. Do it while you are preparing for your ORE exam if you can get a job opportunity. So what are the duties of dental nurse? Duties, as I mentioned, you look after the patients, you set up the surgery, you do some suction, give instructions, sometimes write notes. Some nurses do have duties if they do have like more qualifications. You can take x-rays, you can take impressions, you can use 3D scanners and learn on them, you can learn how to do CBCT, so a lot of things. But in addition to this, there's the downside where you have to do some cleaning. You have to wipe the floor, you have to wipe the windows. Sometimes some of the duties will be to clean the toilets. But any job comes with pros and cons. We have always to remember that we're there for a short period of time. We want to get there. We want to get some money paid. We want to learn the communication skills, get in contact with people, stay in the dental atmosphere. And that's the best way to do it. So doctor, is there any entry requirements? There is no entry requirements. As you are a qualified dentist, they won't ask you really for much. They will test your English skills. So they will say, speak to you, write, communicate, read. If you can do this, there's no problem. Like, you'll get the job straight away. However, if you're in the UK and you haven't done anything in dentistry, nothing related to dentistry, they will ask you for some GCSEs in English, in maths, in something related to this. I'm not really sure before you can start the job, but not a lot of criteria required. How easy it is to find a job. So it depends on few factors. Firstly, your area where you want to live and work in. Secondly, your age and your gender, how flexible you are, and what kind of role you're looking to, like full-time, part-time. When we look for a job, we should look at what we call a trainee dental nurse, because you're not qualified, you are a trainee. So a trainee dental nurse, you can find these jobs on Indeed or BDJ, British Dental Journal jobs website. You search for these and then jobs will come up. You can apply directly. Some of these employers or dental practices will support you with your dental nursing course. As I said earlier, you should be enrolled in a course while you are working as a trainee dental nurse. So some of these employers will pay for your course to go and study. However, some will ask you to pay for your own course and then maybe they will pay it back to you. I'm not sure. A lot of different people work it differently. These courses can be found online. So courses prices varies from 1,100 to 2,000 pounds roughly for about a year and a half. You study like mostly online and then you do exams at the end of this to be registered and be qualified dental nurse. In regards to finding the jobs, it's easy and it depends again on your age and on your gender. Not all people can get it, and if we are freshly graduated from university, we'll get higher chances of acceptance, while if we're like maybe older, they will look at like we may not tolerate the workload, the duties gonna be given to us. So we have to keep this in mind. And moreover, people will prefer maybe female dental nurses over male dental nurses. But like myself, I worked as a dental nurse and I was fortunate enough to find these people. It was in London at the time. So I really appreciate that and always remember those days. So during your work as a trainee dental nurse, you work in the practice for 1.5 to 2 years. You work under supervision of a qualified dental nurse and a dentist. You will have something called ROE, which is like a record of experience or record of competency, ROC. You do upload your like things you learn, the reflective writings. You study some anatomy, some physiology, and some kind of basic dental sciences. At the end of the first year, you will have what we call a theory dental exam. On that dental exam, you will like have some theory questions, anatomy, physiology, basic dental science. But this is piece of cake for us as dentists. You don't really need to prepare anything. You just go and you can pass it. And then the second part of the exam is OSCEs, like to mix some alginate, to mix some GIC, to get some instruments out the drawer, to prepare for a molar extraction or whatever. So this sort of OSCEs. Not a lot of OSCEs. I think it's 5 OSCEs. And most of people pass this exam. It's not a big deal. But for a dentist, if your target is to be a dentist and to be a qualified dentist, you don't need to do these exams. So for example, while you're working as a trainee dental nurse, you manage to get qualified as a dentist, you don't have to do these exams. However, if you want to do it while you're still preparing for your ORA exam, you can do it. One main benefit I want to mention about the dental nursing, and I want everyone to get benefit from it, is if you manage to get qualified as a dental nurse, you'll be registered with the GDC number. This GDC number will allow you to be registered on the ORA candidate list, so without needing to do the IELTS exam. A lot of people struggle with the IELTS exam. They will be able to pass the ORE, but they are struggling to pass the IELTS exam. So this is one pathway to get away from doing the IELTS and get your name on the ORE candidate list and start your journey to prepare and to become a dentist in the UK. So that's one big benefit of doing the trainee dental nursing or the dental nursing, in addition to the things I mentioned earlier. In regards to dental nursing, do I need a visa? People can do dental nursing while they are in the UK, or people on student visa, you can do up to 20 hours a week. People on a work visa, other work visas, and they can do dental nursing. People on a graduate visa, they can do it after they graduate, and people on spouse visa, and most commonly it's spouse visa. So if you're here on a spouse visa with your kids, spouse, husband, wife, you can work as a trainee dental nurse, and it's a good thing. Doctor, can I get a skilled worker visa to work as a trainee dental nurse? Is it possible? Theoretically, it is possible, but like realistically, it's really hard because the amount of money your employer has to pay to provide this visa for you is extortionate. They have to pay for your sponsor license to the Home Office. They have to pay for the certificate of sponsorship to the Home Office. They have to mention in your job offer contract that your salary will be about £38,000 per year, 38.7 per year, and that's a lot. Now, like the average salary for a dental nurse per year, it's between 20 to 24,000 pounds, and that's a huge number. And there'll be no employer willing to pay this much for you unless they know you personally or you do have an agreement. Like I had places, they can charge you 15,000 pounds. You pay it to them, so they get you this and provide you with this visa. You come and work for them for 3 years. It's like modern slavery. You stay with them, you work 6 days, 10 to 12 hours a day. It's like exhausting. And then during these, you won't have time to prepare for your ORE, you don't have time to do your studying. And if you leave any earlier, they'll be breaking clause. You have to pay them fine as you're leaving. So we have to be careful what we're looking for. But is there places offering this? Yes, but like it's very rare and it's very difficult, but don't rely too much about it and on it. If you're in the UK and you're allowed to work, it's a great job to do, especially people on a spouse visa or student visas. Do it and you won't regret it. You will learn a lot. But if you're overseas and you want to come to the UK, look for a student visa or come straight away on a skilled worker visa as a dentist and only do your ORA exams on a visitor visa. I hope this video was not too long. I hope you enjoyed the content, you enjoyed what I mentioned, and if you find it helpful, you find the content of the channel helpful, please subscribe and share it with your friends, and I hope to see you again in my next videos. Stay tuned and take care.